It is the very first question people type into Google when they start researching bariatric surgery. Am I actually eligible, or am I just wasting my time? If you've been struggling with chronic weight issues, you know how overwhelming the internet can be. Today we are going to cut through the noise. I'm going to explain the exact medical guidelines we use here in Australia to determine if you qualify for weight loss surgery, and briefly touch on how to navigate the private health system to get it done. Welcome to the channel. I'm Dr. Ashok Gunawardene. I'm a weight loss surgeon based here in Melbourne, Australia. A quick reminder, this video is for education purposes only. Every patient is unique, outcomes vary, and all surgical treatments carry risks. This does not replace a formal medical consultation, so let's look at the actual criteria. Here in Australia, bariatric surgeons evaluate eligibility primarily using the body mass index, or BMI, alongside your overall metabolic health. Generally, you are considered a candidate for surgery under three main categories. Number one, you have a BMI of 40 or higher. At this level, surgery is considered among the most effective long-term treatments, even if you don't have any other major medical issues. Number two, you have a BMI of 35 or higher, plus an obesity-related health condition. And number three, based on emerging clinical guidelines, we increasingly consider surgery for patients with a BMI between 30 and 34.9 if they have significant, difficult to control metabolic diseases. So, what counts as an obesity-related health condition? The most common ones we see in the clinic are type 2 diabetes, obstructive sleep apnea requiring a CPAP machine, severe high blood pressure, or debilitating joint pain that impacts your mobility. Weight loss surgery, like a gastric sleeve or bypass, works by fundamentally changing your gut hormones. Because of this, it is highly effective in helping manage and helps achieve remission in many patients for conditions like type 2 diabetes. Now let's talk about the practical side of having this surgery in Australia. While you may meet the medical eligibility, you also have to navigate the healthcare system, because waiting lists for bariatric surgery in the public hospital system are exceptionally long, sometimes spanning years. The vast majority of these procedures in Australia are performed in the private system. If you plan to use private health insurance, you typically need to be on a gold tier policy that specifically covers weight loss surgery. It is very important to know that almost all funds enforce a strict 12-month waiting period before you can use this coverage. This is why I always tell patients, if you are even considering surgery, check your policy today. Finally, there is one more eligibility requirement that a BMI chart won't tell you. Are you ready for a lifelong commitment? Bariatric surgery is a powerful tool, but it is not a magic fix. It involves permanent anatomical changes, surgical risks, and a mandatory lifelong commitment to taking specific vitamins, attending regular follow-ups, and overhauling your relationship with food. To be truly eligible, you have to be ready to do the mental and behavioral work that comes after the operation. If you meet these criteria and you are ready to take the next step, the process starts with a conversation. You don't have to make any major decisions on day one. Grab a referral from your GP. If you're here in Melbourne or regional Victoria, you can book a consultation with my team at Northern Surgical Care. We consult across the North and West and via telehealth. The link is in the description below. Hit subscribe for more evidence-based education on your metabolic health, and I will see you in the next video.